And more than 34,000 boosters were reported here in the last 24 hours. Now we are waiting for the CDC director to sign off on expanded boosters. This is the final step in approval after both the FDA and a CDC advisory panel said they support expanding Pfizer and Moderna boosters to all adults.
So with more people potentially heading to pharmacies to get their shots, how are pharmacists preparing for the demand? Jay Jarvis spoke to a leader from a local chain about their strategy.
I can't say they're overwhelmed, but they are extremely busy, so we appreciate the public's patience.
Ernest Boyd, the executive director of the Ohio Pharmacists Association, says pharmacists already provide 70% of Ohio's COVID vaccinations. And now with children ages 5 to 11 eligible and new eligibility for boosters, it means even more responsibility piled on top of their plates.
People need to realize that pharmacists are still filling all the hundreds of prescriptions they were before COVID hit. We're doing our best to figure out how to handle this increased volume.
Leaders with Discount Drug Mart tell us they've seen ebbs and flows with vaccination demand since they started offering them in January. It's picked up again since boosters first became available earlier this fall, and they have a strategy in place to make sure their pharmacists can keep up not only with the shots, but their other duties as well.
We're able to determine what the right number of appointments that we'll schedule within the course of a day in order to strike the right balance of, covering ground and protecting our patients, our community, but also making sure our pharmacists have the time to run a community pharmacy.
And when those appointments do fill up, Director of Pharmacy Operations Jason Briscoe says their plan covers that too.
We go out into the community and look for opportunities to have clinics, whether that be with school systems, especially with this pediatric population, employers, health departments.
Briscoe says so far they've seen less vaccine demand for the 5 to 11 age group compared to the 12 to 17 group, but he does think more people will be seeking booster shots in the coming weeks. If that does happen, he says they'll just utilize their strategy, which has been working for them. And for those concerned about how long it'll take to get an appointment, he says not to worry.
I think we're in a really good rhythm with a healthy number of folks that are registered on a path for their booster, but not in a way that they're going to be waiting for weeks or months. We're talking hours or days.
In Cleveland, Jay Jarvis, News 5.
And there has been a slight rise in hospitalizations among the vaccinated. It is hitting seniors the hardest.
Although the highest risk are those people who are unvaccinated, we are seeing an increase in emergency department visits among adults age 65 and older, which are now again higher than they are for younger age groups.
Long-term healthcare facility residents and seniors were among the first to be eligible for COVID-19 vaccines, so their immunity may now be waning.
When we compare rates of COVID-19 disease between those who are vaccinated with 2 doses and those who have received a booster dose, the rate of disease is markedly lower for those who received their booster shot, demonstrating our boosters are working.
The latest CDC data shows more than 16% of fully vaccinated people have gotten a COVID booster. More than half of those have gone to seniors 65 or older.